Hey, and we're going live. Hey, everybody. It's Dr. Alex Earl here, and we're Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. This is a time where we're going to go over plastic surgery topics, and answer all of your questions. And today, we have a very, very important topic. Yes, I've spoken about it before. We're going to do a brief live today because I'm running behind schedule. If you want to delve into this topic even more, please make sure you go to our YouTube channel. Go to Pure Plastic Surgery on YouTube, and you're going to find live on Clots, as well as many, many other informative lives there. Okay? But today we're going to talk about blood clots. Blood clots. Okay? And why are we talking about blood clots? Because this is something that we are always afraid of, something that could potentially happen. It is a risk with pretty much any surgery, especially any surgery under general anesthesia, okay? So when I say any surgery, it's a risk for a mommy makeover, it's a risk for lipo-BBL, it can be even a risk for someone who has just a breast augmentation, okay? But there are certain things that increase that risk, okay? And we're also gonna talk about that, and we're gonna talk about how to try to minimize that risk as much as we can, okay? First of all, what exactly are you talking about? Blood clots. So there's really two blood clots that we really, that happen after surgery. One is a blood clot to the legs. It typically starts in the back of the leg in that calf region, in the deep veins there. And that's why it's called deep vein thrombosis, or you've probably seen the term a DVT. DVT, okay? And then the other one that we worry about is when those clots travel to the lungs, okay, and they clog up the lungs, and that's called a pulmonary embolus, or PE. So when I'm talking about blood clots, especially related to after having surgery, we're talking about your DVTs and your PEs, okay? And why do blood clots happen? Well, when you break it down to the basic science, there's really three reasons why a blood clot will occur. And that's what we call Virchow's triad. So Virchow's triad has three reasons why you can basically develop a blood clot. So the reason number one is hypercoagulability, meaning you have a condition or a disorder which causes your blood to clot more than it normally, or than it typically or that it should be, okay? What are things that cause a hypercoagulable state? Okay, well, just the fact of undergoing general anesthesia, that increases the risk, okay? Smoking is going to increase the risk. Estrogens are going to increase the risk, okay? That's why we stop all estrogen medications, oral contraceptives, etc., any type of estrogen medication at least 30 days before surgery. It's also one of the reasons why we have patients stop smoking at least 30 days before surgery, okay? Other things that cause increased coagulability are cancer. So if you have cancer for whatever reason, you typically have a higher chance of clotting, okay? So that's why we don't do any patients that have any sort of active cancer going on. All right? So these are different reasons that it may increase your risk for clotting. The next one is what we call stasis, meaning that the blood is not moving around. Okay? And that can happen after surgery because a lot of times people are in pain and they don't want to move and do their walking. And so when you're just sitting there or just laying there, the blood's not flowing, especially through the legs. And so then it becomes more still, and that increases the risk of clots, okay? So stasis is another potential reason for blood clots. And the third is what we call injury. When we talk about injury, we're talking about injury to the actual vessels, to the blood vessels, the arteries, and the veins themselves, okay? What can cause injury to these vessels? Well, trauma, of course. But one of them is, again, smoking. Okay, smoking can cause injury inside the vessel. The other one is atherosclerosis, or basically high cholesterol and things like that can cause injury inside the vessel as well. All right, so any of these three things can increase the risk of developing a DVT or a PE. Okay, so when you're having surgery, of course, by definition, you're going to be undergoing general surgery, so that means general anesthesia, so that increases your risk a little bit. So we got to do everything else that we can to try to minimize that risk. Oh, another important one is BMI. The higher the BMI, the higher the risk of blood clots. okay? That's why I limit my BMI to 30, because we know from multiple studies that as the BMI goes above 30, the risk of blood clots starts to increase significantly, okay? So how do we decrease the risk? Well, first we gotta make sure that nothing's going on with the patient. So we stop the estrogen, we stop the nicotine, we make sure the BMI is under 30, okay? And then the other thing that we know is that the longer the surgery is, the higher the risk. So I want to limit all of my surgeries to not much longer than about 3.5 hours. And that's something I try to do. So if I think something's going to take me longer, then I tend to stage the process. Instead of one surgery, we may do it in 2 surgeries. Okay, this applies more for the massive weight loss patients where they have a lot of things going on. So I'm not going to do the arms, the thighs, the tummy, the breast, the back. I'm not going to do that all at once because it's going to take way too long and the risk for blood clots is going to be way too high. Okay, we're going to stage those surgeries. All right, so these are all the things that we do to try to minimize the risk before you go into surgery. Okay, during surgery, we're going to give you what we call a sequential compression device, SCD. And that's a device that goes around the legs, around the calves, and it has a massage type motion and keeps circulation moving while you're undergoing surgery. All right, this device is very important. It is placed on the patient as soon as they lay on the table, and it's on from the very beginning of the surgery all the way to the very end. Okay, very important. And then after surgery, there are basically 3 options as to what we can do to minimize the risk after surgery. Okay, option number 1 is to actually give you a medication that is an anticoagulant. Okay, basically it thins the blood thinner, common term for that. So this blood thinner typically comes in the form of an injection. The most common one is called Lovenox. So this is an injection that you give yourself, typically in the thigh, once a day for the first week. Okay, so some surgeons like to use this. They use this for all their patients. The downside to a blood thinner is, of course, bleeding. Right? So if it goes too much on the other side, you can bleed, you can develop a hematoma, you can develop anemia, you may need a blood transfusion. So there are risks, okay? So my preference is to use these 2 here. Okay, the first one is that sequential compression device, and that's a device that I give to all my patients that are having a tummy tuck or a mommy makeover. And it goes around the legs, and it has a battery. So it's a battery that you can charge, and each battery, when it's fully charged, lasts 8 hours. And so I give this to my patients, and they use it for the first 2 weeks. And it's like their new best friend for the first 2 weeks because they have to have it with them at all times. You're using it whenever you're sleeping, whenever you're in the car, or whenever you're in the plane, and just anytime you're not being very active. For example, if you're like watching a movie or something like that, okay? Really, the only time you're not using it is when you're in the shower, of course, or when you're actively walking and moving around. So your new best friend for 2 weeks. 2 weeks. Okay? You're definitely, for all our out-of-town patients, you're going to use that on the plane for the flight home. And actually, I use this is mandatory for all tummy tucks and mommy makeovers. But it is also mandatory for any patient, doesn't matter what procedure they're having, who has a flight that is over 3 hours long. Okay, so if you're an out-of-town patient, your flight is over 3 hours, you're going to get this SCD device, even if we're doing a 30-minute breast augmentation. Okay? And then the next thing, this is where the patient comes in. This is 100% the patient's responsibility. Okay? Walking. You have to walk. Have to walk. You can't just be laying on the couch there because you're in pain or because it hurts, because you feel lightheaded. Okay? Because you can have a risk of blood clot, which can be deadly. Okay? So walking is very important. You have to be up and walking at least 10 minutes every hour while awake. Okay? You can walk longer if you like, but no less than that. At night when you're sleeping, you should have your SCD device on, which I highly recommend. Okay? So these are the ways of trying to minimize that risk, although it's never zero. Unfortunately, remember, like I always say, the only way to have zero risk in terms of surgery is to not do surgery, right? The only way to have a zero risk of crashing your car is to not drive cars or not to be in a car, right? Same thing. Actually, the risk of crashing in a car is a lot higher than the risk of this, just to put it in perspective. Okay? But there it is. Now, if you do have a clot, and typically what are the symptoms? Shortness of breath, even at rest. If you're just like, you're not even moving, you're just there, and you develop shortness of breath, you call us immediately, or if you can't wait, you call 911, you go straight to the hospital. Okay? And then the other one is if one leg is a lot bigger than the other. You have a lot of swelling on one leg, it looks very different than the other leg, then that's a reason to call us so that we can do a study to see if there's a DVT. Okay? All right. So I kept it brief, but like I said, if you want more details, you can always go to our YouTube channel. But if you want more detail right now, go ahead and ask. All right, let me answer some questions.
There's any pain on legs?
So when you get a blood clot, some patients describe that there is a pain, like a cramping in the calf area, especially when they move their foot up and down. So it can happen, but I think the opposite is more common, where you can have a blood clot and not have any pain.
Even though I'm doing a BBL, for peace of mind, can I purchase a SCD device? I live in Miami, Florida.
Definitely. I think, let me just put it this way. If I was having surgery on myself, or my wife is having surgery, even though we live here in Miami, we're not traveling, we're not going on a plane, I would put on the SCD device for the first 2 weeks while you're sleeping. So definitely highly recommend it. If you're having a BBL, you're here in Miami, you want some more peace of mind, get the SCD device, get that compression. You can use it at night while you're sleeping. Okay?
If a person had a blood clot in the past, does that exclude them from having surgery?
So unfortunately, yes. At least here in what we call an office-based, completely elective surgery setting, right? If you had a surgery because it's an emergency or something else is going on and they're treating you in the hospital, then of course, you're going to go ahead and have that surgery, and then they're going to do some additional steps to try to minimize risk of blood clots, and they're going to monitor you very, very closely. But in the type of setting that we have, which is completely elective surgery, meaning that it's something that you're choosing to do, and it's an outpatient surgery, meaning that you're going to go home right after you recover, after the surgery is done, then we have to be more specific, more picky as to what patients we're going to bring in. And so anyone who's had a prior history of a DVT or a PE or any sort of blood clot is not a candidate.
I'm in a nursing home right now and have exactly those symptoms. My right leg is huge, red, and really hurts.
Oh boy. Well, I think, I would definitely recommend right now calling your doctor, your PCP, so that they can evaluate you and take it from there.
Doctor, is BBL more safer now?
So I would say yes. The short answer is yes, with the following caveat. If you know who you're going to and they know what they're doing and they're using an ultrasound. Okay? So I think the BBL today, 2023, is a lot safer. And actually, not even, it's a lot safer, and I would just say it is safe. It is a safe procedure as long as you're placing that fat above the muscle, right? And the way to see that you're doing that is with the use of the ultrasound. So you want to go to someone who has a lot of experience doing this procedure and who's using the ultrasound to guide them to make sure they're putting the fat in that safe space. And in that way, we've been able to bring that mortality rate from about 1 in 3,000, which is when everybody was freaking out about this procedure, to today, which is approximately anywhere between 1 in 26,000 or less if you're using the ultrasound.
What's the mostly needed when getting a tummy tuck?
What's mostly needed?
Yeah, for to be approved for getting a tummy tuck.
To be approved, okay. Yeah, so if you want to get a tummy tuck, of course, we need the right indications, which means you probably have some loose skin, you have some diastasis or separation of the muscles of the abdominal wall, as long as some weakness of the muscles of the abdominal wall, okay? And of course, you have to be generally healthy conditions. So you have to be not having a lot of other medical problems, especially none of them which can be active. They all have to be all controlled, okay? BMI needs to be less than 30. You have to be off your estrogens, off your nicotine. These are all very, very important factors.
Do you do reverse tummy tuck?
So yes, we do on occasion. Obviously, it's not as common as your regular tummy tucks because for most people with weight loss and pregnancy, most of that loose skin is actually around the level of the belly button or below. Now, there are a few people where they have some of that excess skin above the belly button, okay? In which case, that's where the reverse tummy tuck comes in place. But a reverse tummy tuck is strictly for excess skin in this area. It's not going to address the muscle separation or the muscle weakness, okay? And the other thing you got to think about is that the scar for that is going to be just underneath the breast, and it does connect in the midline, so there is a scar that kind of starts on one side and crosses all the way to the other. So you got to keep that in mind because a lot of women like to wear like a low-cut blouse or a low-cut dress or whatnot, and so that scar that goes across the midline potentially can be visible there. So you have to think about that.
Can blood clot in right leg develop into lymphedema?
If it's chronic, something that's like chronically happening, it can. Yeah, it is a possibility. So it's not the only reason for lymphedema. The most common reason is what we call venous insufficiency, meaning that the blood doesn't travel well back from the legs back up to the heart without necessarily causing a blood clot. That's the most common reason. But yes, if you have a clot or chronic clots, it can develop lymphedema.
How exactly does ultrasound lipo help with BBL? Seems like one hand is occupied with the guide.
Oh yeah, but fortunately we got two hands. So that's the way it works. So and we have some videos. If any of you want to go to our Instagram, we do have a few videos there of kind of just me showing you how I do it. But that is quite correct. So I have the ultrasound probe on one hand. So I'm holding the ultrasound probe on one hand, and I have the cannula on the other. And so with the one hand, I am, projecting that image. And then with the other hand, I have the cannula. So I'm placing the cannula and I can see exactly where that cannula is. I want to make sure it's in that safe space between the skin and the muscle. And once I visualize that cannula, then I squeeze on the plunger to then, transfer the fat. And so that's how we do it. So yes, one hand has the ultrasound device, and the other one has the cannula.
Okay. If you're a smoker, how many months prior do you need to quiet to be able to have a BBL?
At least 30 days before. Okay, so 1 month or 4 weeks prior. That's the bare minimum. So 30 days before surgery to 30 days after surgery.
Okay, and the last question is, Doug, do you perform liposuction before the tummy tuck?
It depends, actually. In some patients, we start off, I'll start off with the liposuction and do that part first. In other patients, I may, start kind of dissecting up the flap, doing the muscle repair, and then doing the liposuction at that point in time before we set the patient up to then remove the excess skin. So it can be done at the very beginning of the procedure or in the middle of the procedure, either way. All right, 20 minutes already?
Yes, sir.
Okay, excellent. All right, well, I know, guys, today was a little short. So, of course, I want to talk about what you guys want to hear, okay? So please let us know, what topics you want me to discuss. Send those over. You can send it via DM, okay? So we make sure we cover those topics, and I'll catch you all next week on Hump Day with Dr. Alex Rowe. All right, I'll see you all then. Ciao.
And say thank you, please, to the TikTok because
Yeah?
we got 3,500 likes.
Really?
It's a record.
All right, awesome. We love that. We also love the what is it, the dinosaurs?
Yeah, not today.
No dinosaurs? All right, next time we'll get some dinosaurs. All right, everybody, it's been great. I'll catch you all next week. Ciao.